Today we are going to discuss very important terminologies regarding respiratory system, and we'll move from the basic to the advanced. So let's get into it. First is ventilation. Ventilation, it is basically the movement of air in and out of the lungs. It is the movement of air in and out of the lungs. Next we have perfusion. Perfusion is blood flowing through the pulmonary capillaries. Perfusion, it is the blood flowing through the pulmonary capillaries. Next we have oxygen saturation. It is the percentage of hemoglobin bound to the oxygen. How much percentage of hemoglobin is bound to the oxygen is known as oxygen saturation, or it is denoted by SpO₂. Okay, next we have respiration. It is the process of oxygen and carbon dioxide exchange between body and the environment. Okay, oxygen and carbon dioxide gaseous, these two gases exchange between body and the environment. Next we have external respiration. External respiration is oxygen and carbon dioxide exchange between alveoli and pulmonary capillaries. This is external respiration. We have internal respiration. It is oxygen and carbon dioxide exchange between pulmonary capillaries and tissues. Next we have cellular respiration. Cellular respiration, it is a cellular process for the production of ATP by using oxygen. Cellular respiration, it is a process where ATP is produced by using oxygen. Next we have inspiration. Inspiration, it is an active process where the air, it is entering the lungs. It is an active process where air, it is entering the lungs, and here diaphragm and external intercostal muscles, they play a major role. Next we have expiration. It is usually passive, and here air, it leaves the lungs, and in this the diaphragm and external intercostal muscles, they come back to their original position. Then eupnea, it is normal, quiet breathing. It is eupnea. Then we have tachypnea. In tachypnea, respiratory rate is increased, that is greater than 20 breaths per minute in adults. Okay, respiratory rate, it is breaths per minute. Okay, this is breaths per minute. Then we have bradypnea. Here respiratory rate is decreased, that is greater than 12 breaths per minute in adults. Next we have apnea. Apnea is temporary cessation of respiration or breathing. Okay, temporary cessation of breathing, it is better. Temporary cessation of breathing is apnea. Then we have dyspnea. Dyspnea is labored or difficult breathing. Then we have hyperpnea. It means increased depth of breathing. Okay, hyperapnea is increased depth of breathing. Next we have orthopnea. Orthopnea is breathlessness or we can say dyspnea in lying position. When the patient is lying flat, they complains of dyspnea. Okay, dyspnea is difficult or labored breathing. Next we have platypnea. Platypnea is dyspnea worsens in upright position and improves while lying flat. It is the opposite of orthopnea. In platypnea, the dyspnea, it worsens when the patient is upright, like sitting or standing. The patient complains of dyspnea or breathlessness. But when the patient is lying flat, they're completely normal. Okay. Next we have hyperventilation. Hyperventilation means ventilation exceeds metabolic demand, and it results in decrease in partial pressure of carbon dioxide. Okay, and hypoventilation, it is when ventilation cannot fulfill metabolic demand. Okay, cannot fulfill metabolic demand or cannot meet. See, hyperventilation is when the ventilation, it exceeds metabolic demand. The patient is taking breath, but that is too much. Like the carbon dioxide, it washes out from the body. Okay, and the breath the patient is taking, that's too much for the body. The body do not demand that much of ventilation. Okay, so which results in the oxygen, it is the level of oxygen, it is increasing. Partial pressure of oxygen is increasing. But same way, more breath means more carbon dioxide wash out from the body to the environment. That results in decrease in partial pressure of the carbon dioxide. And hypoventilation means when the ventilation, it cannot meet metabolic demand. The patient is not taking enough breaths, okay, that the metabolic demand of the body is met. Next we have hypoxemia. Hypoxemia means decreased level of oxygen in the arterial blood. In the arterial blood, the level of oxygen, it is not up to the mark. Then hypoxia. In hypoxia, decreased level of oxygen or supply of oxygen in the tissues. The tissues, they do not have enough oxygen level. That is hypoxia. And hypoxemia. Emia means related to blood. In hypoxemia, decreased level of oxygen in the arterial blood. But in hypoxia, decreased level of oxygen in the tissues. Next we have anoxia, means complete absence of oxygen in the tissues. Okay, anoxia is complete absence of tissues of oxygen in the tissues. Next we have cyanosis. Cyanosis, it is the bluish discoloration that is due to reduced supply of oxygen or increased deoxygenated hemoglobin. Okay, bluish discoloration due to decreased supply of oxygen. Usually the extremities, they turn blue. Then we have hemoptysis. Hemoptysis means coughing out blood. Okay, or the sputum, it has blood. It means hemoptysis. Then we have sputum. Sputum, it is mucus produced by the lower respiratory tract. The lower respiratory tract, it produces mucus. That is known as the sputum. And why does it occur? It occurs due to some irritant. Okay, it is a response of the lower respiratory tract to some irritant. Then we have productive cough. Productive cough means cough with sputum is productive cough, and dry cough is cough without sputum is dry cough. So these were the terminologies. I hope you understood it well. If you have any doubt, you can put it in the comment box. Thank you so much.